Get started. So good morning, everyone. Welcome to our December Better Breathers webinar. Today's presentation is about COPD and healthy living. If you have any questions for our guest speaker, please use the Q&A feature and we will address them at the end of the presentation. Today, we are joined by Dr. Shelley Dillon-Bala, who is a family physician in Abbotsford. Dr. Dillon-Bala completed her postgraduate training at Indiana University in 2016 and started work as a family doctor shortly thereafter in Abbotsford. She grew up in Abbotsford and is grateful to be able to provide care to her community. Dr. Dillon-Bala is the Abbotsford Division of Family Practice Long-Term Care Physician Lead and co-chair for the Older Adults Project. Her medical passions include senior care and lifestyle medicine. And in her spare time, Dr. Dillon enjoys spending time with her husband and her family. So take it away, Dr. Dillon-Bala.
Okay, thank you. Hello, everyone. Thank you for having me, and thank you, Maureen, for that introduction. So as you can see, the topic for today is COPD and healthy living. I will review healthy lifestyle changes to better manage chronic conditions like COPD. I think I was originally asked to discuss COPD management and medications, but then asked to speak more about healthy living in general, which I actually love talking about. You know, especially with short clinic appointments, it never really allows me to go into detail about it with my patients. So thank you for that opportunity as well. So to start off, I think we'll talk a little bit about what COPD is. So COPD is chronic obstructive pulmonary disease. It's a chronic or long-term condition that causes airflow obstruction in the lungs. Symptoms of COPD can include a chronic or nagging cough, shortness of breath, especially during physical activities. You can have mucus production, wheezing, chest tightness, and a lack of energy. It is diagnosed clinically by your doctor, so that means, you know, in the office, and then confirmed with breathing tests. Luckily, for being active, healthy living can help prevent and treat disease and COPD. Healthy living strategies can often be overlooked, unfortunately, but can lead to big improvements in your overall health. And the good news is, it's really never too late to start. To prove that point, I do want to highlight a study published in the American Journal of Medicine that proves it's never too late to start a healthy lifestyle. So what they did in that study is they found that a switch to consuming at least 5 fruits and vegetables daily, exercising at least 2.5 hours per week, and maintaining a healthy weight and not smoking lessen people's chances of heart trouble by 35%. And that was only after being in the study for 4 years. It also lessened their risk of dying by 40% compared to people with less healthy lifestyles. And I think the mean age of people starting those healthy lifestyles was in their late 50s. So you can imagine just 4 years of making a few changes can dramatically improve your health. So let's talk about COPD and healthy living. So number one, you know, the most obvious is don't smoke. So there are 4,000 chemicals in cigarette smoke, and more than 50 of these are known to cause cancer. Smoking is the most common cause of COPD. Other coke, so if somebody smokes around you for extended period of time, especially. AirPollution antitrypsin deficiency, that's a genetic deficiency, and asthma. Quitting smoking should always be the first priority for anybody living with COPD. Quitting smoking will help slow the progression of COPD and help your body be more receptive to the treatment. Quitting smoking also decreases inflammation in your lungs and improves your immune system, so you're not getting those infections that can lead to more progression in the COPD. Quitting smoking can obviously be tough, so always consult with your doctor if you or someone you know is interested in quitting. I do direct a lot of my patients to quitnow.ca. It is a BC government-funded quitting smoking resource that provides coaching, planning, and even help with coverage for medications like Wellbutrin or Champix and nicotine replacements. So moving on, exercise regularly. So regular exercise is part of a healthy lifestyle, even if you have COPD. Find time to move every single day. You can try walking, biking, swimming, dancing, or water aerobics. Any physical activity is better than none. And the more activity you're doing, the greater health benefits you're going to achieve. Exercise can actually improve the body's use of oxygen. It increases energy levels, reduces anxiety, stress, depression. It improves our sleep, our muscle strength, and feelings of shortness of breath. But of course, always make sure to consult with your doctor before starting an exercise program, just to make sure that it's safe for you. And if you do have significant symptoms or you're not really sure how to exercise or what is safe for you, then pulmonary rehabilitation might be right for you. Some of you may already know about it. So pulmonary rehabilitation is education and exercise classes that teach you about your lungs and your disease and how to exercise and be more active with less shortness of breath. If you think pulmonary rehabilitation might be right for you, do request a referral from your doctor. I think we don't have one in Abbotsford, but we do likely have one in Langley, and I know there's people from outside of Abbotsford too, but that's at least from locally where we go. And just like we need a variety of different foods, we do need a variety of different physical activities. So do try to incorporate some aerobic activity like walking or swimming, some flexibility training like stretching and yoga, and also some resistance training like resistance band training or weightlifting. And as a general rule of thumb for any exercise program, do start slowly and keep moving up, and discuss with your doctor if a new exercise plan is right for you. So moving on to eating healthy. So really obvious things right now, but these things really do make a big difference. So the foods you eat can affect your breathing, and the right mix of nutrients can actually help you breathe easier. Some people with COPD can use more energy for breathing and can burn 50% more energy than somebody that doesn't have COPD. And with progressive COPD, you can also develop taste alterations, usually due to dry mouth. You can get early feeling of fullness, which can contribute to decreased food intake, and eventually can lead to things like weight loss and malnutrition, which we don't want, obviously. To make sure you're getting the right nutrients, your diet should consist of more plant-based whole foods like vegetables, fruits, whole grains, seeds, legumes, and nuts, and less processed foods, like chips, cookies, instant noodles. You want to really make sure you're getting adequate fiber intake in your diet from foods like chia seeds, lentils, and berries. We know fiber helps a lot, especially, if you have comorbid conditions like high cholesterol. We know that it can actually lessen that as well. And do make sure to eat heart-healthy, unsaturated fats like avocados, nuts, plant-based cooking oils, and fish. I really like the image that I have displayed on the screen right now. It's actually the newest edition of the Canada Food Guide. I think it came out about 1 or 2 years ago. And there wasn't a lot of industry influence in this. That's why a lot of people actually endorse Canada's Food Guide. So and this is kind of a general rule of thumb that I actually tell my patients as well, that half your plate should just be vegetables with some fruits, and then you have smaller portions of whole grains and lean proteins. I will talk a little bit about progressed COPD and meal planning. So it is generally recommended if you have more progressed COPD to eat 5 to 6 smaller meals per day rather than 3 big meals. This will keep the stomach from filling up too much, which gives the lungs room to expand. You do want to eat slowly, take smaller bites, and breathe deeply while chewing. Make sure you're always sitting upright to eat to make it easier for lung expansion and to avoid aspiration of your food, which just means you don't want it going down the wrong tube, right? Do avoid overeating and do ask family to help with meal preparation if you find it difficult, or consider asking for the Meals on Wheels program. With advanced COPD, you can also have more muscle breakdown, so your doctor or your dietitian may recommend adding extra protein in your diet. You can get that through things like Boost or Ensure that you guys have probably seen. I would just keep in mind some of those come with a lot of sugar, so if you are a diabetic or pre-diabetic, you really want to be careful with those. It is also recommended to consume at least 6 to 8 glasses of water per day, unless, of course, you have some kind of heart or kidney issue that restricts the amount of fluid you can have per day. Your doctor would have advised you on that anyways, and if you're not sure, make sure you're always asking them. And always make sure water is your drink of choice. Avoid high sugar juices and pops, excess caffeine or alcohol, obviously. You do want to avoid eating too much salt. Too much salt can make you retain fluid, which will make it harder to breathe. Especially look out for sodium content or salt content in deli meats, canned foods, condiments, and fast foods. Those usually contain exceptionally high levels of sodium or salt. It is recommended for the whole day that you try not to get more than 2,300 milligrams of sodium or salt. And it may even be lower if you have chronic conditions like congestive heart failure. And I do want you to keep in mind, people with COPD are at increased risk of osteoporosis or low bone mass because of long-term use of steroids. So it is recommended to make sure to get 1,200 milligrams of calcium and 1,000 international units of vitamin D per day. And I know that's a lot of information about food. If you ever have concerns about your diet, you can always consider seeing a dietitian. And we'll move on to the next point. So get your recommended vaccines. So first, I'll talk about the pneumonia vaccine, or Pneumovax 23. It is recommended for all adults with the diagnosis of COPD, and you'll likely receive a one-time booster 5 years after the first dose or after you turn 65. The next recommended one would be the flu vaccine. Make sure you get that once a year. And then we have the pertussis or whooping cough vaccine, that's the Tdap. BC CDC does make the recommendation that all adults should receive 1 dose of Tdap if they have not previously received pertussis-containing vaccine in adulthood, but it's not provided for free in BC, so not a lot of people actually end up receiving this. The last time most of us would have received it was during our grade 9 immunizations. There is a second pneumonia vaccine that some people might be curious about, and I can talk about that at the end if you guys want. So next is to learn proper inhaler technique. So good inhaler technique is essential to maximize the benefits of the medications and improve outcomes. A clinical study actually showed when you have patients show how they use their inhaler, 90% of them were doing it incorrectly. That's an extraordinarily high number, obviously. Studies have shown when people are asked, 75% of them will say they're very confident in the way they use their inhaler, but when those people are asked to demonstrate how to use it, only 10% show actually proper inhaler technique. And if you're not using it correctly, you're not getting the medicine, and you could potentially progress the COPD, which we don't want for everybody. So incorrect inhaler technique is associated with increased use of your rescue inhalers, increased use of emergency services, worsening COPD control, and higher rates of COPD instability. So what do you do if you think you're one of the people who might not be using your inhalers correctly? You can ask your doctor to refer you to the community respiratory services. I believe it used to be called the Breathe Well program. I know the referral in my clinic still has that name, but I think it's the Fraser Health Community Respiratory Services now. The Breathe Well program is open to anyone who has a diagnosis of COPD, and it comprises of community respiratory therapists who provide education and coaching. I have referred a few of my patients, and they have been very happy with this resource. What are other resources we can use to get educated about proper inhaler technique? So you can always ask your doctor. I will be honest and say, you know, sometimes we're not always the best resource for it. A respiratory therapist is always going to be the gold standard for that. Other things you can do is ask your pharmacist, especially if you get a new prescription. And the way that these devices are made, they're all kind of different. Make sure you're asking your pharmacist how you should be using that medication. And next, since we're still talking about medications, you do want to make sure you're using your medications as prescribed. So COPD, yeah, technically can't be cured, but it can definitely be treated. Early diagnosis, lifestyle changes, appropriate drug treatments can help you lead a normal and active life, feel better, and try to stay out of the hospital. Some medications need to be taken only when you need them, like a rescue inhaler. Others you need to be taking regularly. They're also called maintenance treatment to prevent flare-up or prevent symptoms from getting worse. So if you're not sure which medication is for what, ask your doctor or your pharmacist. Studies have shown when patients use their medications as prescribed, it leads to fewer hospitalizations and fewer COPD symptoms. So it is obviously very important. Now, just more general healthy living tips. So, you know, you want to make sure you're making and maintaining healthy social connections. Research has proven meaningful social interactions are important for good health and longevity. A study of 7,000 men and women in California found that people with close social ties actually live longer than those with poor social ties, independent of their other lifestyle choices. So they could be a smoker or not eat right, but if they had good social support, they did better. So, you know, just a reminder, take time to call your family, go for a walk with a friend, or join a social activity club while obviously staying safe during this pandemic we're going through. And I really commend actually the Better Breathers support programs and groups for providing support to people with lung conditions. A support group is effective because it can offer you a place to share your thoughts with others, as well as support and empathy only other people affected by the lung disease can understand. So next, see your doctor for periodic preventive. You can still see your doctor for periodic preventive health visits. Your doctor may review your cancer screening, blood tests, advanced care planning, and immunizations. With COPD in particular, it's really important to review your symptoms with your doctor on a regular basis and review your medications. Your doctor really doesn't know what they don't know, so be really open about your symptoms. You know, are you using your having difficulty? Is your breathing restricting you from any of the activities that you normally would do? Have you ever been hospitalized for your COPD? When was the last time that you were hospitalized? Do you need a referral to a lung specialist or community respiratory therapist? And those are just some of the examples of things related to COPD that may be discussed. But just in general, make sure you're going for your periodic COPD checkups and letting your doctor know how your symptoms are doing. Moving on. So tip number 9 is to manage stress. Constant stress, we all know, can take a physical toll on your health. Learn to manage stress with things like exercise, having a positive outlook, being adaptable, and controlling how you respond. If you can't change a stressful situation, learn to adjust your expectations and how you respond. Especially, I see this a lot, to learn to say no and set boundaries with people at work and at home. And don't be afraid to ask for help whenever you need it. So tip number 10 is to make sure your cancer screening is up to date. The purpose of cancer screening is to find cancer early so you have the best chance of recovery. We currently in BC have screening tests for breast cancer, colon cancer, and cervical cancer. Breast cancer screening can start as early as age 40 with routine mammograms. Colon cancer screening usually starts at age 50 with FIT tests. And cervical cancer screening starts at age 25 with routine Pap tests. And we know screening for cancer works. Routine mammograms, and this is BC data, has reduced deaths from breast cancer by 25%. And colon cancer screening has increased colon cancer survival rates to 90%. But what about other cancers? Unfortunately, we don't have enough medical evidence to support regular screening of most other cancers. We do offer lung cancer screening now, but it is quite new over the past few years. It's nothing that's provided generally as a just like we do with the colon, breast, or cervical cancer screening. But you can get that through the BC Lung Screen Trial, which provides a low-dose CAT scan of the lungs for people with a heavy smoking history, and I believe it's after the age of 50 at least. So what else can we do? So learn breathing exercises. There are 2 breathing techniques that can help you get the air you need without working so hard to breathe. So there's pursed lips breathing and diaphragmatic breathing, also called belly or abdominal breathing. I'm sure most of you are actually more familiar with these techniques even than I am. I will talk a little bit about pursed lips breathing today. If you want more details, I would suggest looking for online resources or being referred to pulmonary rehabilitation. Pursed lip breathing techniques helps you focus, slow your breathing down, and stay calm. To do pursed lip breathing, before starting any breathing technique, take a minute to really drop your shoulders down, close your eyes, relax. Breathe in through your nose for 2 seconds. Pucker your lips like you're getting ready to blow out a candle on a birthday cake, and breathe out very slowly through pursed lips, 2 to 3 times longer than you breathed in. And you want to repeat that until you're feeling more relaxed or your breathing is better controlled. If everybody wants to try that, it's great levels too. So everybody take an inhale for 2 seconds through your nose and then out through your mouth with pursed lips for 4 seconds. So let's try that. Good. So next, yeah, I will tell you, pursed lips breathing helps slow your breathing down, keeps airways open longer so your lungs can get rid of more stale, trapped air, reduces the work of breathing, increases the amount of time you can exercise or perform an activity, and improves the exchange of oxygen and carbon dioxide in your lungs. So my next tip is sleep well. Obviously, that's easier said than done. COPD can leave you more fatigued, so getting plenty of sleep each night is very beneficial. Restorative sleep can help you maintain a healthy body weight, improve your mood, ward off any cardiovascular symptoms, and keep your immune system better equipped to fight off infections. If you're a poor sleeper, instead of focusing on medications, I would more suggest treating with sleep hygiene. Even when patients are having sleep difficulties and it's bad enough, they're chronic insomniacs, I refer them to a sleep clinic. They will not start with medications. They will start with sleep hygiene techniques first because they do work and they are better and safer for you. So how I always explain it to people is just like we have to sleep train our babies, we have to sleep train our bodies. So keep the bedroom exclusively for sleeping. That means no TVs or screens in the bedroom. If you're not asleep within the first 30 minutes, make sure to get out of bed, do something relaxing like reading a boring book, and try to go back to sleep again. Try to go to bed and wake up at the same time every single day. That routine really helps with the rhythm of your sleep. Make sure your bedroom is quiet, dark, and cool for the best sleep. Exercise during the day also helps for better sleep. For some folks, exercising too late in the day can make your sleep worse. So if you notice that, try to exercise earlier in the day. Do establish a bedtime routine, going back to kind of that baby reference, just like some parents give their baby a bath before bedtime. Figure out what bedtime routine works best for you. And that could be, you know, reading a book, having a warm cup of milk, having a bath time. And then you do want to reduce caffeine intake. Obviously, I always recommend, you know, 1 cup per day, only in the morning for the whole day. Do not drink alcohol to go to sleep. There are some people who think it might help them fall asleep, but we know chronically doing this will lead to worse sleep in the long run. And lastly, try to reduce your fluid intake 2 to 3 hours before bed. So hopefully you don't get up as much during the night to use the bathroom. And I think with that, I did hit the 20-minute mark. So just remember, healthy living strategies can seem obvious, but often are overlooked and can really lead to big improvements in your overall health. And you know, everyone should be taking time to see where we can make that difference for our health. Thank you everyone for having me. I also want to take time to thank the Abbotsford Division of Family Practice Older Adults Shared Care Project for supporting this talk. And I do want to announce that there is, as part of the Older Adults Shared Care Project, we will be releasing an Age Well, Plan Well magazine that has articles written by local doctors and allied healthcare providers with lots of information about local resources available to older adults in the Abbotsford community. So please look out for that. And now I guess we have a few minutes to take questions just about COPD and healthy living. I guess, Maureen, I'll pass that over to you.
Thank you so much for that wonderful presentation. Reminder again, if you have any questions, please use the Q&A function. I do see, maybe I'll get started with one question here. Are people with COPD more likely to be impacted by COVID-19?
Technically, yes. I know that for heart disease, we were seeing a significantly more increase in issues, but just having any chronic comorbid conditions, our concern is that obviously any infection would cause a more prolonged infection. Yeah.
All right. And will COVID-19 make COPD symptoms worse in the long term? Do we know sort of enough about that?
Yeah, at this point, we really don't. I know in Vancouver, they've set up a prolonged COVID-19 kind of clinic that, you know, if people were having chronic symptoms related to COVID-19, they're going to follow them in the long run. But yeah, it's just too early to tell with COVID-19. I know there's a lot of interest about it right now, but it's just such a new virus. We just don't know as much about it.
All right. Okay. Next question. What are causes of dry mouth?
Oh yeah, so dry mouth is a big one. There's actually hundreds probably of causes for it. The reason though people with COPD generally get it is because of either their inhalers or just because of the inflammation response of COPD can cause dryness of our mucous membranes.
Great. Next question. Someone is interested in getting Prevnar 13 and the Fluzone high dose trivalent. So what would be your recommendation? Should she go see her doctor or talk to her pharmacist about that?
Yeah, so Prevnar, according to the BC CDC, you know, and people practice differently than even what the BC CDC recommends, which is what we should be going by. It's not actually recommended unless you have immunodeficiency, like you had a splenectomy or some kind of other immunodeficiency disorder that requires you to have extra protection for pneumonia. So Prevnar is like the second pneumonia vaccine. I personally, because when I worked in the US practice, and it was recommended there, still do offer it here for patients. It's just there is no cost, and if the BC CDC is not recommending that everybody should have it, then it's not an absolute necessary thing. To get it though, if you are interested, you do still have to see your doctor and they have to write the prescription. So then you can go to the pharmacy and have it administered either by the pharmacist or taken back to your doctor. As far as the Fluzone, the high dose, unfortunately, I think by now most places are out of stock. I think we ran out of that one pretty quickly. The best place to ask would be the pharmacy or public health.
So somebody's wondering about stem cell therapy and whether that is something that could be available in Canada as an alternative to a lung transplant. Your thoughts on that?
Yeah, that would be more specialized, so I can't speak too much about that, unfortunately. Sorry, I wouldn't know too much. Yeah.
Okay. And another thing, I guess, related to the pandemic, are there any masks that's more suitable for those who struggle to breathe?
Yeah, I mean, a regular medical mask should be okay for most people. And if people are having significant issues, you can get the face shield. But even with that, I've heard from patients that can be very difficult as well. So, the nice thing is that Dr. Bonnie Henry at least made that recommendation that if you have medical reasons that you can't wear it, hopefully that'll support some of our patients that are having more issues with it. But yeah, that's kind of where we're at right now. And I hope the new year will bring us into a better place with the COVID-19.
All right. I think we have time for a couple more questions.
Okay.
Why is mucus buildup a problem with a lot of COPD patients? And are there any tips that you can provide in terms of how to clear the airways?
Yeah, that's a really good question, actually. So mucus production happens because COPD chronically causes inflammation in our lungs. So, and our cilia, which are these little bristles in our lung tube that are supposed to help move it out of the way, but with COPD, sometimes we just get extra mucus. Another thing that causes the extra mucus is, and why people usually notice it more in the mornings, is when we're sleeping, now all of that mucus is just collecting in our throat, and that's why we have more mucus to bring up during the morning. So things you can do to try to help with that, I mean, obviously keeping up with your medications as prescribed, and then humidifiers can cause some decrease in that, or just steam from a hot shower, regularly clearing your throat, especially in the mornings. If it's exceptionally bad and you don't have a COPD flare-up at the time, you always want to make sure that's not happening. You can try things like antihistamines if it's safe for you, like Reactin or Benadryl at bedtime, to try to help dry up some of the mucus.
Okay, and so lastly, does someone with COPD eventually need to be on oxygen therapy?
Not necessarily. I actually have quite a few patients, you know, if your symptoms don't progress to that severe stage, you can go your whole life without oxygen. Yeah.
All right, sounds good. Okay, I think that's about it for questions. So once again, thank you to Dr. Shelley Dillon Bala for taking time out of busy schedule to be with us today. Thank you everyone for attending. As always, we are recording this webinar, so it will be available on the BC Lung website in the next couple of days. And also, Dr. Dillon Bala mentioned about a magazine. And it's actually, I got a message here that it goes live tomorrow. So if you go to www.hulplanwell.ca, you'll be able to access that magazine, and hopefully you'll find it helpful. So once again, thank you so much.
Thank you.
Yeah, so have a great holiday season coming up, and we will see you in the new year. Thank you.
Thank you.